All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and this is a treatment that we do all the time that you guys ask about constantly, but we don't post about it a lot. The use of Sculptra mixed with fillers to give volume to the buttock and improve cellulite as well as tighten the area. I coined a term called Bella Lift a long time ago where we used Bella Fill plus Sculptra, which was a long-term filler, but more recently, a newer filler came to the market that acts more like your own fat. It actually calls fat cells into the area. This is called Renuva. So we have Renuva in here mixed with Sculptra to get not only collagen production, but also fat production. This is a basically regenerative medicine. This is a synthetic version of fat that helps build this area. It's actually really good for my slim model patients. I would say my skinny women. It's hard for them to have buttock volume. They lose it really easily, especially when they exercise. There's drooping and sagging that occurs with low volume. So we use this combination to give volume and give lifting, but with a procedure or without, or just alone. So we're gonna start treatment right now. Squeeze from your butt as hard as you can. Perfect, relax. And we're just gonna focus on giving lifting. So there's gonna be a little pinch, a little burn at the beginning, and then we inject. And there's material that goes in that we're gonna massage.
Dr. Yoel's on here.
Excellent. Squeeze again for me. Relax, good. Now this filler combination's a little bit thicker, so we have to use a bigger needle, but there's numbing inside, so it shouldn't feel as bad after a few pokes. Squeeze again for me, relax. And then the only thing that you have to do afterwards, there's really no restriction, is just some massaging. I tell people over the next couple of days, you just massage or people will exercise, and that will help. Good, squeeze again, relax, perfect. Doing great. We just fan the area, because remember, this is a material that's going to go into the area and call other cells in to build. It's not like an actual filler. This is volumization over time. Squeeze again. Relax. Perfect. And this combination gives an amazing result. I have a lot of patients to do it. They're even asking me about other areas of rejuvenation for this, so we'll find out in the future as we keep going with treatment.
Can you talk about combining this with Ovally?
Yeah, and then the other thing is that with you have cellulite on the buttock. In the old days, there really wasn't anything that worked very meticulously for the cellulite. We had something called Selfina that used a needle kind of all over the area. We used injectables like this. We used radiofrequency treatments. There's a new treatment now called Ovally or Avelli that helps to literally break apart the bands meticulously. It uses a light guided hook on the area of the cellulite, so you can combine it with this and get an even better
We
result.
have questions. You want to know how often do you need it and approximate cost?
Squeeze again for me.
It's going to depend on how much you want and what filler we're going to combine it with. If we combine it with Bellafill, Radies, Renuva, the price is going to differ based on that. Dr. Yoel says, yes, get that booty. Great to have options for every patient.
That's true. And the thing is, again, we don't know the number per se, so now we go to the other side.
It depends on a case-by-case basis of how many, right?
Right, it depends on what we're looking for, like if it's just hip dip or you're trying to lift. My focus for her right now was just to give upward volume. I want lifting through this area, so the majority of the volume is through here in kind of an angled approach, so it makes the buttock look a little lifted. I'm going to do the same thing on the other
They
side.
want to know what is being injected. That is going to be Sculptra and
to the other side
Renuva.
now. Squeeze for me. Relax. Go ahead and tell him, Jordan.
That's Sculptra and Renuva
Pinch.
mix.
Exactly, and I do it nice and slow. There's some numbing inside. But again, it's really more of a long-term building. She'll feel it in there over the next couple days because the Renuva is actually like a paste. It's like thicker, but then it dissolves in the area like fertilizer and then calls in the cells. Squeeze in again. Relax. Perfect. It calls in those fat cells to help build that area up. So this combination is literally the most advanced in terms of volumization of the buttock besides a BBL or fat graft.
Will that work for the hips too? Yes, it will.
And you know, we've shown you other fillers, but they would take so much more. Squeeze again. Relax. Perfect. Takes so much more in volume to actually get.
Someone said here in Brazil, the women love this.
They do, I know. In Brazil, they actually do that more with PMMA, which we talked about, which was the Bella Lift I was telling you guys about. But I think this is a little safer and it's gonna be a little more natural.
Someone's asking if that is Sculptra. Yes, it's Sculptra mixed with Renuva.
One more left.
Does that work for facial fat loss?
It does actually. It was originally approved for facial fat volumization and fat loss. So now a little bit more to the middle of the buttock. Squeeze again. Relax. Perfect. Last one. Just doing really good. So again, Sculptra and Renuva combo for volume. And then the only thing we'll have her do is just do light massaging and exercise over the next few days. That's it. We're gonna put her under a red light just to decrease swelling. And again, I do light massaging because remember, this is more of a paste, so it's gonna feel like there's material in there, but she barely bled. Only a few incisions. It can be done even with a cannula, but this was a great technique. So you could see overall now more height and a little more lift to the buttock, and we'll see how it builds over the next 6 to 12 weeks. This is a permanent solution for volume, you guys. You might need a few maintenance treatments over time, but once we inject this, it builds naturally for many years. Bye. Good, I'm glad we did it extra. Cool, all done.